Can you tell us about the state of diabetes here in the Rio Grande Valley? What does it look like for adults?
So if you think about it, diabetes is the number one problem in the valley. Everybody will relate having family members that have diabetes. So it's the number one problem in the valley. And I think I can link it diabetes and obesity because they are matched together. So it's a growing problem for the whole country in general. We think that half of the population in the next 10 to 20 years are going to be diagnosed with diabetes. Right now, 30% of the population has a confirmed diagnosis of diabetes. And then the other part is that 50% of the patients have prediabetes. But the most concerning part of that is that most of the patients do not know that they have diabetes. And then they come up to our services when they are already fully diagnosed. So that's an ongoing problem. And then that we need to hopefully educate our populations about how to identify how the patients are high risk and then address it quickly. Because the sooner that we intervene, the better the outcomes are we're going to be. We don't want patients coming when they need insulin or in the end stages of diabetes. We want the patients to be addressed really quickly and in a timely manner.
Did you know how bad the situation was here in the valley when you arrived here? Were you aware?
Not really. I had a little bit of suspicion because the obesity rates were, and the valley unfortunately has been number one, number two every other day in terms of diabetes, but I was not expecting what I got here. So as soon as we got here, we got really busy, and then we have seen super complicated cases. We see high numbers of obesity and complications for diabetes. I was truly not expecting that, but somehow on the couple of years that we've been here, we've been adjusting and then hopefully to try to bring awareness. And that's why this type of conversations are important, because the patients see us 10 to 15 minutes, but we need to kind of have ways to educate the population about what they can do so they don't become a patient. And if they are a patient, that they look for attention relatively early in the disease. One of the things that make us proud about DHR Diabetes and Endocrinology Institute is that we believe in the concept that when a patient comes to see us, it just don't only come to see a doctor. It comes to see a group of people. So I think what can separate us from the rest of the institutions is that we believe in a teamwork. And in that teamwork consists not only of physicians, we have 4 great physicians. We have a pediatric endocrinologist, which most of the practices do not have. But then we have a group of people behind us. So we have 3 nurse practitioners that are certified diabetes educators. And then one of the unique features that we have of our institution is that we have 2 clinical pharmaceutical ladies that are wonderful, and they help us to see the patient. So basically, when a patient comes to see us, it's not only seeing a physician endocrinologist that is going to guide the management, but it's going to see a group of people that is going to try to empower what's going on with diabetes, try to look for the correct diagnosis, try to look for the correct medications, but then on the other hand as well, try to change lifestyles, assess nutrition, assess education for diabetes, which is important. You won't have any idea how many patients we have that when we say, okay, you have to inject insulin, they don't know how to inject an insulin. So we as physicians guide the initial approach and the management, but we rely on a group of people that are going to help our patients to understand and to navigate. And even sometimes with the initial approach with a physician, the patients are scared. They don't feel that they don't have a communication directly with the physician because the time is limited. But we wanted to make sure is that we provide a group of people that are working together, they are talking together to provide center and the best case possible in our patients.
And the medical nutrition therapy, registered dietitians at the DHR Health, Endocrinology and Diabetes Institute work with patients to develop personalized meal plans that help manage blood sugar levels and promote overall health. How does this benefit the patient?
So having an in-house, in the facility, registered nutritionists and dietitians is, I think, the most important piece of the puzzle in managing disease. Because if you see a physician, it's not only to get a medication, but it's to get a live therapy to change what was wrong and to try to behave in a little bit of a different manner. And then these particular ladies that help us in the clinic, they are expert in the field. They've been in the valley for a long period of time, And then they try to focus and try to understand what the patient is eating, what we can improve the diet, correlate with the medication that the patients are taking to try to improve as much as we can the major issue with the disease, which is what we eat and what we don't do. So in addition to provide excellent nutritional counseling, we always reiterate to the patients the importance on the non-prescribed therapy. And the non-prescribed therapy is exercise and physical activity that is going to change the shape of the disease. So we wanted to care not only about giving and prescribing medications and assessing the correct patients, but try to change the patient's lifestyle, which is the most important thing that is going to change outcomes significantly.
Innovative treatment options. This institute utilizes advanced technology and treatment methods, including insulin pumps and continuous glucose monitoring systems to help patients manage their diabetes more effectively. Can you tell us more about this?
Correct. Yeah, diabetes, since it's a super permanent disease, thankfully is the faster growing field in terms of innovations. So we have not only new medications that are coming basically every 3 months that we have to keep updated, but the new thing is the application of diabetes technology into helping our patients. And then that comes in forms of diabetes pumps or continuous glucose monitoring devices that allow the patients to check the blood sugars frequently without necessarily going and poking the fingers. So that involves a team as well. So we are proud to provide all the service and the latest technology in terms of insulin pumps and glucose, continuous glucose monitoring device are available. And then we have to analyze a patient case by case, including insurance coverage. But we are trying to get most of our patients into this new type of technology that truly changes the way. And then we have a different approach. And I think that's what I wanted to reiterate, what it makes us different. So when we decide, for example, that a patient gets an insulin pump, it's a two-way process. So physician takes care of the initial discussion. We get this patient assessed and evaluated by our team of clinical diabetes educators to make sure that we have two sides of the coin, what the physician thinks and what the diabetes educator thinks that the patient will do. And then that has guaranteed us that when a patient goes into one of these technologies, including insulin pumps, the patient knows what he's doing and the patient is going to benefit from it. Because it's not the right idea just to place patients on these devices, not explain the patients correctly what they're going to use, because that's going to be a failure. So we guarantee to all the patients that come to our clinic that you're going to have different layers to try to make sure and the guarantee that whenever you get to that technology that you're paying, it is really expensive, that is really that you use it in your favor.
Comprehensive care. DHR Health emphasizes a team approach involving nurses, dietitians, and healthcare providers to ensure high-quality care at every patient encounter. How does the DHR Health Endocrinology and Diabetes Institute differ from other health organizations in this respect?
Diabetes and Endocrinology Institute is a team, and I think I'm keeping reiterating every time that we work as a team. We started initially with affiliation with Joslin Diabetes Center. We learned from them, but we try to imitate the good things that they did, and we try to separate them and then try to be better. And I think with time we have been doing that. And I think it all compasses about having a team of people working together. And then as we have been discussing, physicians, clinical educators, and then our nurses are together into one team to try to make sure that the patient can be reassured that he's going to have a group of people behind it trying to support, even with simple questions about what the medications is, how to inject correctly the insulin, into more complicated stuff, including assessment for the patient willingness to go with diabetes technology. So I think what set us apart is to have a team-based approach for many people involved, not only one physician leading the medical decisions in a patient.
Dr. Palacios, is there anything else you would like to add?
So I think for all the people that are taking the opportunity to listen to us and to see us on the social media platforms, it's an important month. November is Diabetes Awareness Month. We all know family members or have somebody that's been treated. It's all about awareness. If there are signs of symptoms of problems with diabetes, or if a patient has uncontrolled diabetes, don't let the time pass, because every single minute, day, or month that you have an uncontrolled diabetes, it counts in terms of worsening complications for diabetes. We are the number one leading cause of blindness in the country, amputation in the country, kidney transplantation in the country. So everything is diabetes related. So we wanted to make sure that we can provide tools to patients so we don't get to those stages, and then we treat them relatively quick in a safe and a nice manner. I mean, the important thing is to make sure that our patients feel that when they come to see us, they are going to see a group of people that the only objective is to work towards getting that diabetes where it's supposed to be.